And joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University's Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
So some optimistic news there from the CDC. Do you agree with their assessment?
Oh, yes. No, it's absolutely right. What this is reflecting now is the changes that did take place in these out-of-control states like Florida, Georgia, Texas, and Arizona when they finally implemented some mitigation measures. And so the rates have come down. They had to get shocked and fill up their ICUs, and people on ventilators have the death rates skyrocket before they would act. But it's paying off. It works.
So does this mean that we're in a downward trend with COVID-19?
No.
Why not?
Yeah, we're down off the peak. That's okay. But what's happened is the Midwest, including Illinois, is just kind of gurgling up in the number of cases. As you've reported, there's still almost 2,000 cases a day here in Illinois. And about 1 to 2% of the new cases in death. So for every 1,000 patients, there's 10 deaths associated, 10 to 20 deaths associated with that. That's what you have to think. And so the Midwest is slipping out of control, not in the crisis mode of the southern states, but in our own kind of just can't stop the epidemic here.
So, Dr. Murphy, a lot of people hear that number of 2,000 cases a day, but we're testing more people than we ever have, upwards of 50,000 every day. So, what does that mean, those numbers? People hear that and they say, of course we're going to have more cases.
It's a really good point, Robin. The problem is that we should be testing probably close to 5 to 10 times as many cases as that. So we're still at the bottom of the testing scale. We should test more cases because there's more disease out there. You know how a lot of these people have very mild disease. We're missing them in the counts as well.
So I want to get your opinion on some of the things that are happening at universities. We're seeing all these stories about college students becoming infected. 15 states now reporting positive tests at universities. Seems to be two reactions to this when there is sort of a minor outbreak at some of these universities. Some schools, kind of react by moving all the students into remote learning. Others are deciding to, well, let's just isolate the students then that do have it and still have the students go back to class. What do you think the right strategy is at a university if a couple of kids or maybe 100 kids come down with COVID?
Well, but that's the clinical question. When is it so bad that you just have to shut the whole place down? So the University of North Carolina gave up after 1 week. And it was for two reasons. One, their numbers were higher. They had these relatively huge clusters, and they saw with their eyes that the students were not following the rules they agreed to when they returned to school. Big gatherings of people at night and in dorms and fraternities and whatever. And they couldn't control it, and they said, okay, let's cut our losses here. You go learn another way. You go online, whatever. Notre Dame, they shut it down, but just for 2 weeks now. Although the football team has just canceled practice and I think their opening game because I think it's 5 players tested positive. So it's sliding out of control there too, even though they've tried very hard to do this the right way.
All right, let's get to some viewer questions. This person says, I've heard that the positivity rate is the number to pay attention to understand how the virus is spreading. What number would indicate the virus is virtually no longer spreading throughout the state or the country?
It's a good question. It's an easy answer. 0, right? 0, then it's gone. But the way it's reported when you have less than 1.
Less than 1%. Okay.
Okay. I'm a healthcare worker. I work in surgery. Many of us had antibody tests back in May. How accurate was that test? If you had antibodies, you would think that more of us would have had the antibodies. Are current tests more accurate than the ones that were being given back in May?
This brings up a couple things. The original test that came out, most of them were very bad. So, I don't know what test this person had. So, you can always go get another one because what they did, the FDA got rid of all those first ones that were junk And the ones that are available today, like the Abbott test and the Euroimmune test, and there are many others, are very good, and they've been tested and validated, and they're terrific. So if there's a question, go get tested again. I think the original issue was more that they were having false negatives. But anyway, just get tested again if you're unsure.
All right, last question. My family and I all had COVID in March and had the antibodies for it. We are no longer immune. If no one has contracted COVID a second time, do we need to worry about being in high-risk places if, in theory, we can't get it again?
This is actually a really great question. It brings up a very important thing. 60 million people supposedly have had COVID in the United States so far. The terminology is a little mixed up here. They're immune. That means they're protected. So if you have the antibody, immune. So we still have not documented one person getting COVID twice, like from a different virus. That hasn't been documented. So these people are immune. It's like they had the vaccine. So they are actually not at risk. Now, they could go outside and say, I had COVID, I have an antibody test, but we're actually moving in that direction. There will be a day, especially when the vaccines come out and all these people become immune, that people are going to have either on an app or some paper or something that, they have the antibody test, because it's going to be those that are immune versus those that are not immune.
Oh, boy.
It's like we have I don't know if you've traveled with the little yellow international vaccination card. There's a place there for yellow fever. So yellow fever, very dangerous disease. Like when I travel, my work in Africa, when I go from country to country, I always have to show that card. It's going to be similar with coronavirus.
All right, Dr. Murphy, thanks for joining us again. If you have a question for the doctor, you can go to our Morning News Facebook page and post it there. We'll talk to him again on Monday. Have a good weekend.
Have a great weekend, too.